Hey, everybody. Welcome to Resiliency Radio, your go-to podcast for the most cutting-edge insights in integrative and functional medicine. I'm your host, Dr. Jill, and with each episode, we dive into the heart of healing and personal transformation. As you know, I have guests from all over the world with the most exciting innovations and treatments and just things to help you in your life and personal transformation. Most of the stuff on the podcast, I'm learning right along with you, and I'm super excited for today's topic and today's guest. I'll tell you a little bit more after we introduce him about my own personal experience. But first of all, let's get to the chase and let me introduce my guest. Steve Anderson is passionate advocate for advancing healthcare through innovative treatments, focusing on the transformative potential of stem cell therapy. As co-founder of Renue, a leading private medical clinic in Mexico, Steve is dedicated to helping patients optimize their health and well-being. With years of experience in the healthcare space, he's become a thought leader in regenerative medicine, continually exploring the latest breakthroughs to offer patients cutting-edge solutions. Outside of his role at Renue, Steve is a respected speaker at industrial conferences where he shares his insights on healthcare advancements and growth strategies. Welcome, Steve.
Thank you, Jill. It's great to be with you.
It's great to talk to you. So I'll just real quick tell a little tiny backstory, and then I want to hear about
Sure.
you because I have been researching and looking at stem cell clinics, and they are a dime a dozen all over the place. And yet I've always had a little bit of are they really using the best research? Are they using the best science? Are they using the best technologies? Are they actually counting cells? And we're going to dive into that today about what makes your venture different because I remember talking to one of your representatives at a conference and just being like, oh, these guys do it differently. Like I knew right from the beginning. And then you and I got on a call a few months ago, and I was just so impressed with your story, your heart for helping people to heal. And let's start there. Tell us a little bit about how in the world did you go from this industrial leader and entrepreneur into the world of stem cell therapy?
Yeah, so my whole career really has been in the investment management business. Never really had a real job, I guess, is what I like to say. And then about 10 years ago or so, I got diagnosed with a really awful degenerative disease that had kind of found its way to my lumbar area. And the so called experts, if you will, in the US and Canada were pretty convinced that the degeneration was so rapid and so aggressive that it would be very difficult for me to even diffuse discs or to do any of those things that are kind of conventional, what we would consider to be conventional therapies in order to stabilize my situation. And so they kind of felt like I'd be confined to a wheelchair within the next 36 months. And of course that was unacceptable, right? I'm very active. I like to work out, play pickleball. I played professional tennis. I've my whole life I've tried to be athletic and do those types of things. And so it really led me on a pilgrimage with my physician, who's a concierge physician, to kind of look throughout the world and try to find somebody that could help us. And then ultimately, I got into a stem cell trial, believe it or not, that was sanctioned by the FDA. And it was the physician was in Beverly Hills, California, and I went out and did a procedure, which today I look back at that technology and I kind of giggle to myself that we would never do. That's archaic today compared to where the science is today, but it sure enough it worked. And I just a few days later I started to get relief, and then we started to do bookend images and look at MRIs, and sure enough it had stopped the degeneration, in some cases reversed the degeneration, and I have been in remission ever since. And that's the only treatment that I've ever had, and that was, geez, almost 10 years ago.
Wow.
But that, fast forward, and I'm in the recovery room with John, and I said, "Hey," um, he said to me, "There'll be a next time for you. You'll leave remission at some point. We'll have to do this again." He said, "Let's do it in my office in Dubai." And I was kind of like, "Well, besides the beaches and the shopping, I'm not sure I get it." And he went on to explain to me that the uh, the type of technology that they could use in the U.S. and Canada was incredibly limited compared to outside the U.S. and Canada, and that we could use actually donor cells in Dubai, where they had to use my own cells in the United States. And so I started to really question him about that, and that led me on a down a big rabbit hole of trying to, because at that point in my lifetime, I thought that the only quality healthcare in the whole world happened in the United States. I thought there's no way anybody outside of the U.S. does healthcare like this. And boy, was I wrong, and so that's kind of what got it all kicked off. And then if you fast forward about 3 years, I woke up in the middle of the night and I've been nagging this nagging feeling that I had all these people I did business with that were incredibly wealthy and successful and just weren't living their best lives. They're hobbling around. And I remember that the day before that, I got off a call with a partner that I have in a housing business, and he's a billionaire, and he's just hobbling around and doesn't either know who to ask, what to do, or conventionally they want to replace everything, and he just didn't want to do that, and so it led me to believe that there's a better way. And so I woke up that in the middle of the night and decided I was going to build a world-class facility somewhere outside the US and Canada where we wouldn't be subject to either Health Canada or the FDA. And there's sometimes draconian and political views on things, and that we were going to try to find a place where we could build a platform. And I think that's really important. And we'll talk about that. I think that we've built a platform where we try to take the best technology that's available once completely vetted. And obviously, we have a whole scientific, roundtable that looks at all these technologies and says, hey, this looks good and that looks a little too dangerous. And just to build a platform where people could come and just actually get better. And if fast forward now, I guess 5 years later, well, you've seen the manifestation of
Yeah.
what that looks like these days.
Yeah, gosh, it's so exciting. And I just love, sometimes the most important and meaningful transformations happen almost in an instant. And it sounds like you had that like shift just that one night where just like you saw the vision. And thank goodness you're the kind of man who not only sees it, but follows through, because here now
Yeah.
I have this, I have such admiration for that. I remember you telling me that in the beginning too, because again, a lot of people have a little thought and then they ignore that. But the way to really transform the world is to take those ideas and then and I think what your next step was, right? You made some calls and all of a sudden, my experience too is like as we have those ideas, we step out in the world and then if it's the right thing, the world and God will manifest all the resources that we need.
Yeah, it was amazing. And I remember the next morning I told my wife and she looked at me like I was crazy. And then I picked up the phone and I called 11 family office or families that I did business with, and no pitch deck, no
Yeah,
PowerPoint presentation.
yeah,
In my world, that's like the ante. You can't talk to
yeah,
anybody about any idea unless you've
right.
got it fully baked. And I was so passionate about it when I woke up. I just picked up the phone and I called 11 families. Every single family said, yes, where do we need to wire the funds? We have the same issue. We don't feel like we think it's symptom management in the United States and Canada. We're not getting better. We can tell that our family members are getting worse. And if there's another way, we're willing to explore that and try to figure out how to make it happen.
And wow, it happened. So
It
I'll
did.
tell my part here. I just went down to visit your clinic about a month ago and just absolutely blown away. And you know what? I love Steve more than anything. You have and we'll talk about what are you providing? Why is it the best quality? Why is the technology some of the best? We're going to go into that, so stay tuned. But I want to tell you something that I think I shared with your staff after I left. The people you have surrounded yourself with are so quality. And I remember when I built my clinic, I knew, the skills you can teach, but you need people with hearts of compassion and service and love, and you need them to show up with that kind of energy because I think healing starts when a patient feels safe and they feel like they are genuinely cared about. They feel like they're treated like a unique human being. And you have done such a great job, not only of creating one of the most beautiful facilities I've ever seen, the design and the everything about it is gorgeous, and the quality you've put into it, but the people. I was so impressed by your team and by your partner and by your wife and by all of the staff that I got to come in contact with. And I want to say that first and foremost because it takes a special person to know that that might be the most important part of healing.
Yeah, no, I appreciate that. They're amazing. And I'll tell you, it took us a while to get them all together, but it's funny. It's a very different environment there, obviously, than here. In Mexico, a 6-day work week is very common.
Wow.
In fact, we're open on Saturday from 9 to 2.
Uh-huh.
That's very common in Mexico. They basically have one day off.
Uh-huh.
But these folks just love to hang together and be together. And it was really important for us to find the right people, put them in the right seats, give them the right resources so that they could, get out there and actually help people. And that's a really important difference. And I hope we dig into that, because real healthcare is not what you're experiencing. There are physicians like you and some of these other physicians that are in that really, I consider the functional medicine space to be doing some really incredible things, but you get very far afield from that, and you're down the road, down the middle of the fairway. MDs, it's the wrong financial model. It incents volume
Yeah.
versus actually, the people getting better, and so I think it's just stacked against the consumer.
I could not agree more. And now is the time when patients are fed up. They're seeing that this isn't working and they're not getting the care. In fact, nowadays, when I see someone who's been in the ER, I'm kind of terrified because so often, I mean, those docs, they're working hard. I don't mean to take away from they're trying.
They're great.
It's so dysfunctional, and I can't tell you the number of times I'm like, they didn't examine you. Like things like that are so
Yeah.
basic to medicine that you can't even believe it's happening, and yet it is. And I know if you're listening out there, you probably all have a story about what I'm talking about. So tell us about you. Obviously, I love your integrity in as far as the quality of what you provide. What is different about Renew? Because I saw this when I talked to your people at the conference, but tell
Mhm.
us kind of bullet points of what makes you guys different from many of the other clinics.
Yeah. So right now in Mexico, there's, as you rightly pointed out just a few minutes ago in your opening, that there are roughly 3,500 physicians that purport to do some type of what I would call advanced cellular therapy or advanced orthobiologics, and principally, the utilization of exosomes, stem cells, that sort of thing is so there's about 3,500 of them, and that's a lot. And so when we looked at building our facility, it was really important to us, especially because of who our folks were, right? So we ended up with 40 investors, so 40 of some of the wealthiest families in the US, and it was really important that we provide quality service to not only those folks as our founders, we call them, but also to everybody that walked through the door. And so we stood back and took, almost 18 months to do our due diligence, where we secret shopped and flew all over the world and looked at facilities and talked to people and went and got treated and did all kinds of things. And there were a few things that everybody did really well, I thought. We'd go to a facility, we'd go to Colombia or Panama, wherever it was, we'd go to a facility, we'd look and see what they were doing and say, hey, they're doing that really well. That's great. We'd write that down and say, if we're going to do this, we got to do that right really well. And we ended up after 18 months with, a list of what I would call the best practices, although I think that term's overused, but the kind of best practices. And we said, we need to do those things. So we went about that. We call that the Renue difference.
Hmm.
And I can list a few of them for you. So first of all, in our facility, every single physician is a specialist, is the equivalent of a board certified specialist. We carry roughly 17 specialties on staff. So everything from urology to orthopedics to spine to neurology, we carry them all on staff. And the appropriate specialist does the appropriate work. So this is not a situation where somebody went to, was a GP and went to a 6-day course in Vegas, and now they're a plastic surgeon.
Yeah.
That's not what we ever envisioned. So if you come and it's a musculoskeletal issue, and we're gonna shoot your knee or your shoulder or your elbow, that's going to be done by an orthopedic surgeon. Is going to do that work, not a urologist, not somebody acting like that. And that was really important to us, and that's come through to really high caliber work and high caliber outcomes. And that was one of the things that was important to us. It was also very clear to us early on that we needed to have chain of custody, right? Because of not just because of Mexico and this perception that things are subpar, if you will, but more importantly to us, it was, we wanted to prove to people that what they were paying for, they were actually getting. And so it became important to us to build our own laboratory, have our own set of PhDs and biotech engineers on site. And in fact, as you know, when you come in our facility, you have the ability to kind of look through the glass and look into the laboratory as they're actually doing their work. So we so how our process works is at any one time we have roughly, let's call it 10 or 12 young women in our program. And how they get in our program is they get referred by their physician that tracks them through the gestation period and ultimately delivers a child. Because one of the arrows in our quiver, which we have many, but one of the arrows in our quiver are what are called day zero or Wharton's jelly derived day zero mesenchymal stem cells.
Mm-hmm.
So in essence, they come from the cord and the placenta. But more importantly, they come that the cells that we use come from the Wharton's jelly portion of the cord. And so we have roughly 10 or 12 women at any one time in the program. We're following them throughout the whole gestation period. Their physician comes to us and says, hey, I've got a great candidate here. It's their first pregnancy. They meet our age requirements. And so we pay for everything. We pay for well care appointments, delivery, pharmaceuticals, whatever's necessary, right? And we're kind of tracking them along the way. And they're continually getting tested by us during that gestation period, which they agree to. And then ultimately, we're trying to take that number from 10 or 12 down to about, 2 or 3 out of that group, kind of the best of the best, if you will. And so it doesn't matter how they get out of the program. They can miss an appointment. They can blow a test. It doesn't really matter. We're just trying to narrow them down. Now, they don't know that. We continue to pay for everything. And when it comes time for them to donate the cord and placenta to us, we just dispose of it. We don't bring it in. We only bring in kind of the best of the best. And then it's tested at the hospital for everything you can imagine. And then it comes into our facility and we test it as well. Then once everybody agrees that the material is safe and is also what's very important to us is it has to be ethically derived. So that means that mother and child have to be okay. If either is compromised during the process, then we would dispose of the material. We wouldn't use the material. So it has to be a successful birth. That's really important to us. And so then once it comes in, then our biotech engineer and PhDs, they start the harvesting process. Once they start the harvesting process, we can go from, let's say on the first harvest, let's say we get between 7 and 10 million cells in the harvest. I can go from 7 to 10 million to roughly 9 billion cells in about, call it 33 days. So they really grow not exponentially, they grow geometrically. But it's an incredibly expensive thing to pull off because of all the safeguards and things that are necessary. And that's where the cells come from that we use for kind of lots of different treatments, which I'm sure we'll talk through. More importantly, once those cells are ready to be either injected or nebulized or whatever the modality is for whatever the treatment is, then they're harvested from the incubators that are on site. So they're not being flown in from another city. They're not being bussed in. They're not, because cells, as you know, as a scientist, they don't like that jostling. They don't like the movement. That
freezing and thawing or any of the stuff that they go through, right? Yeah.
Exactly. They hate all that stuff. They come from the womb. They come in a transplant, kit like you would if you're going to take eyes or a kidney or a heart, and they come into our, ISO class 6 laboratory, right, where the air turns over every minute and 3 seconds. The whole volume of air turns over inside the lab itself, and they go in incubators that are perfectly suited and look just like the womb, right? And so, but then once that they're harvested, ready to go for that day by one of our engineers, then it goes into the next phase is called the flow cytometry room. So a flow cytometer, for those that don't know, is a very expensive piece of equipment. You could buy a really nice house in Boulder or wherever you're out there living for what it costs for one of those machines. And what it basically does is it tracks what are called CD markers. CD markers are kind of expressions, and it tells us in order for it to be a mesenchymal stem cell, some CD markers have to be present and some have to be absent. And that's important. So that's the next step. It goes through a portal, goes into the room. By the way, you as the patient can come and watch this.
Yeah.
If you want to see it live, you can watch your cells live being harvested in the flow cytometry room. Flow cytometer does three things. First thing it does is, hey, these are what we say they are. Second thing it does, it checks bioavailability, how many are alive and how many are dead. This is a really important point that I caution people that are getting treated at facilities that don't have the same safeguards. Senescent cells or dead cells being injected in someone can be worse than the condition that you have.
Mhm.
And so we want to know bioavailability. It better be in the upper 90s.
Yeah.
Otherwise it's not going to meet our quality criteria, and we're going to dispose of those cells and we're going to go back to the well. And the third thing the flow cytometer does is it counts them,
Mhm.
which is really important. But for us, everything's belt and suspended. So we count them a second time and check bioavailability a second time with a second machine. It's called fluorescence counting.
Mhm.
And it's another accurate way to count it, just differently. Now, a lot of our competitors use what's called bright field counting, which is kind of a Trajan blue ink dye style of counting. The problem is that it's the wrong type of counting for these types of cells. It works very well for some biomaterial, but it doesn't work well for these because it overcounts
Yeah.
the cells. Because when that dye goes in, right, they're looking, the machine is looking for it to if it breaks and goes inside the cell, it says it's dead, right? But what it does is it also highlights all the what we would call cellular trash,
Mhm.
and so it just overcounts, unfortunately. So it's really important for us, if you're going to spend the kind of money that it takes to pull some of these things off, that you're getting what you're paying for, and there's science and professionals to back that up.
Mhm.
So that's kind of why it's so critically important. And if you looked across all of North America right now and you said to yourself, how many facilities have an actual certified laboratory on site doing that, you could count them on less than one hand
Wow. That's
in
what,
the whole.
again, what impressed me from the beginning, and then going to see it, it's just really impressive. Now, one of the things I want to talk about is your big submarine-like thing, which is hyperbaric.
Yeah,
Because we've seen,
yeah,
I mean, all over the place, there's a soft, and you've got a board certified amazing doctor there who I love, both of your doctors there with hyperbaric, loved meeting them. But tell us a
yeah.
little about why that is so important. Because again, for me, it was profound how you integrate that into your treatments.
Yeah, so our facility is not like most, in the sense that, let's say you're going to come down and you have a knee issue, osteoarthritis in your knee, and it's giving you crazy amounts of pain, right? So a lot of the facilities you could fly in on, take Tijuana, you drive across the border from San Diego and go in the afternoon, they'd stick a needle in your knee and you can drive back to San Diego that night. The problem is the efficacy rates are really low when you don't do what we call these complementary treatments that go along with it. Because remember, what we're trying to accomplish is we're taking these cells from the absolute perfect environment, right? I mean, statistically, from the perfect environment to grow, and they've been growing like gangbusters. We've built an army. We're getting ready to turn that army loose because they're unassigned. Remember, those cells are unassigned. They're not a hair follicle cell. They're not a neuron. They have yet to be assigned. And we can talk about the properties of them and why that's so critically important. But what's really important is that when those cells come out, and if we put them in a body that hasn't been prepared,
Mhm.
so many of them perish right away that it's impossible for people to get really high levels of efficacy outcomes. So remember, in that womb, it's incredibly oxygen rich, right? And it's incredibly nutrient rich. And so we have to rebuild that environment as best we can in the patient so that the graft or the transplant will take. Big part of that is hyperbaric oxygen work, which I will tell you, I think in 20 years, we'll look back, not just in our space, the regenerative medicine space, but we'll look across all chronic diseases and we'll say to ourselves, we missed the boat. This hyperbaric oxygen thing was incredibly important and we missed it. So let me give you an example. This is one of the things that drives me crazy. The FDA right now allows what are called on treatments, right, or on book treatments, are for hyperbaric oxygen. I think there's 12 or 13 now. where they've said, okay, these 12 or 13 things, we would say you can use hyperbaric oxygen work for. If you went to Germany or went to the Czech Republic, it would be in the hundreds.
Yes. Yes. And
And
as
it's
functional medicine docs, we use it for more than that too. But you're right, the FDA approved uses is
yeah,
small.
it's tiny, and and the Israelis are so far ahead of us in
Mhm.
this understanding. They have the largest clinical trial that's ever been done, more than 300,000
Wow.
people in an HBOT clinical trial. But for those that don't know what we're talking about, you take a chamber. Ours happens to be a really large multi-plos chamber where you can technically sit 6 people in the chamber itself. But and you enter the chamber. It has to be hard sided. These kind of soft sided chambers out there that go to 1.5, 1.6 atmospheres. There's no real medical benefit from 1.4, 1.5, 1.6 unless you do it for a gazillion times in a row. So it needs to be kind of a hard sided chamber. That would be best. And it simulates taking you down. Most of our treatments are done between what's called 1.8 and let's call it 2.2, 2.3 atmospheres. So right now, you and I are standing at 1 atmosphere, right? So to get to two atmospheres would simulate roughly 33 feet below the surface of the water. So not only do you have the kind of the external pressure, if you will, of oxygen in the actual facility itself, but for about 80% of the treatment, you're breathing pure oxygen through a mask in what's called a roller coaster protocol. And the Israelis are the ones that really made this famous, is that they figured out that by enriching and depriving your cells of oxygen, that it generates something called ATP. And ATP is a technical term, and I like to always talk about things in layman's terms, because some of the stuff, you're a medical doctor, I'm not. Some of the stuff is way over my head, but it is the mitochondrial energy.
Yeah, that current
ATP
basically.
generates. Yeah, you can explain it better than I, but so it
And just for
generates
fun,
that.
as you're talking, Steve, I'm going to just share really quick. If you guys want to see, this is a photo of what your chamber looks like.
Yeah,
Pop it
yeah,
on there
that's right.
really
There
quick.
she is.
Yeah,
Yeah.
that was at your clinic, and I wanted people to see this because this is not like, again, in our town or anywhere I can go. There's these soft chambers, and my experience was so profound with the hyperbaric because
Mm,
I have done soft chambers. I either don't notice or sometimes I feel worse. And I want you to talk about not only the chamber, but which is, like you said, a whole different ball game, but also the oxygen that you produce on site. I'll tell you just a little side story. Mexico is so moist. And of course, I didn't stay at your clinic. I went to see you guys every day and did treatment. So I stayed at a hotel. And I get to the room first day and it's moldy. And I'm really sensitive to mold.
yeah.
Surprise. So just so people know, you can stay anywhere you want. This has nothing to do with your treatment. It was the hotel off-site. But I'm typically very sensitive to mold. That first day, I'm like, well, let me try and just see. I'll open the windows. As soon as I started doing those hyperbarics, Steve, I've never had such a good response in a moldy hotel. And I know that the hyperbaric was part of that. And this is a side note, but I think it's so important because a lot of my listeners have other issues. And to me, it was so profound, the quality of what you created with the hyperbaric and also the outcome on the stem cells in my shoulder. So
Mm,
anyway, it was really profound, just the feeling of how different I felt with those treatments.
yeah, I'm here to tell you, I think that um, and we have plans to build a much larger chamber. I've got the drawings done, and
Mhm.
to build a 20 or 25 place chamber to treat something specifically, and that's cognitive decline and
Yes.
Alzheimer's. And yeah, no, there's some incredibly exciting things going on in that space that people are just not paying attention to in the US, primarily because there's no way to really monetize it. Big pharma can't monetize something like that. But to your point about again, part of the Renue difference is not only we have a big chamber like that, but we also have a small chamber that is connected to it that allows for us, if someone's compromised, we do a lot of traumatic brain injury work with folks. And if we see somebody who has congenital heart failure or traumatic brain injury or something, we'll put a trauma certified tech to sit and ride along at just a little bit different pressure And then if there's a problem, we can even the pressure and they can breach the door and go in and help somebody. But in addition to that, the oxygen thing is really important to us. So normally in a facility like that, how you would get the oxygen is you go buy it from a company like Inferon or somebody who would bottle that up, if you will, and bring it in, and trucks would bring it in and switch them out and do all that sort of thing. That was really bothersome to me in particular because I'm a freak about chain of custody. So we built a 1,200 square foot building out in the parking lot of the hospital, and we make our own pure oxygen in that facility itself on site that we have cameras on and we're in control of. I just couldn't take the chance that this tank would be sitting out in a warehouse yard somewhere and somebody tampers with it or does
Right.
something with it, and so we just felt like we couldn't take that chance. So it was really important to us to do that. Although it was incredibly expensive to pull that off,
Mhm.
still it's worth it because of the peace of mind of what's happening. But again, I would just tell people that are out there listening that I think we'll look back on this and say we should have done more. That especially in the neurologics, what we call the neurologics, so ALS, MS, Parkinson's, you know,
Or
TBI.
stroke, yeah, like you said, because you've had quite a few stories. That's a thing for me. I've been in this world. I've read the research on hyperbaric. I have not seen the clinical outcomes, but you know why? It's because these soft 1.3 atmosphere chambers and even 40 sessions, patients are like, oh, maybe a little better, or maybe temporarily for a month or two, I felt better. But because of that, I've kind of been like, well, the data's there, but I'm not seeing it in clinical practice. And then my
Yeah,
experience at Renue, which I did 4 treatments just due to time. I probably would have done 5 had I been there one more day,
yeah.
but it was profound. And it was just so profound that it literally shifted my thinking on hyperbaric. So I just can't say enough about the fact that you've included that because I feel like that is one of the game changers that's going to increase your outcomes exponentially for
I
those
think
people.
it does.
Mhm. I'm sure you've seen
I
it. Yeah.
Oh yeah, for sure. And the other thing I would say is that there's even something that's more profound and dramatic in the hyperbaric world, which is if you get somebody to 20 or 23 treatments, and we see this in our TBI patients, and we kind of stumbled across this, and now we really watch it, but somewhere in between that 20th and 25th treatment, we start to see the cells change in terms of their efficiency of operating in the oxygen environment. And so that's really fascinating to me. And we're following up on that. We've got a longitudinal study where we're looking at those things, trying to better understand them. And we did a little bit of cross pollination with the Israelis in their work, and they are substantiating that what we're seeing is exactly right,
Wow.
that there is a change. And they even went any further to say that um, if a woman goes through that process and then has a child, that she transfers that to the child,
Wow.
which is really interesting to me. But yeah, anyway, I, I think hyperbaric oxygen, especially in conjunction with the other parts of the treatment, right? So we do a lot of vitamin IVs. We've gone away from NAD plus. We did that about maybe a year ago or so. The side effects were, although we saw some really good outcomes, the side effects I think led us away, and so we've moved to kind of an NMN cocktail, which is the precursor to NAD plus. And for those of you that out there that don't know what NAD plus is, it's kind of, I like to say it's a gasoline to the cells. Again, trying to get them in the best possible scenario for the grafts to take place and for to get help when they get there, and all those other things. But I think there's a lot of the things that we do that cause our average patients with us a week.
Yeah.
It's truly a wellcation. They're with us a couple hours a day. The rest of the time they're out on the beach. They're fishing, they're playing golf, they're doing, all those things that one would love to do on a beach vacation.
Yeah,
So
it was just, and I'll just describe for those listening kind of my treatment plan. I think it's kind of standard, and then we'll go into like people listening, maybe what
sure.
kinds of conditions are your best. So you guys created a plan for me, and I was just there maybe 6 days. I think if I would have been there 7, I would have had one more day of hyperbaric. But I chose to do a IV, or not IV, I'm sorry, injection in my shoulder. I had a small tear in my supraspinatus and a
Mm.
tendonitis that had been bothering me for like months, probably 9 months of pain and injury. And what you offered was not only the stem cells, I think we got 10 million in both sites, and then you also did PRP at the same time. And I'd love for you to
Yep.
explain my experience with that was the PRP, although we don't have as much long-term data on that, it created this lubricant anti-inflammatory effect that I literally within 24 hours had relief. And talking to other people who've done stem cells without the PRP, it's they're not getting that quick relief. So my experience was within 24 hours, I would say 80% pain-free. And I expect now, this has only been a month, that over the next couple months, I'll have a lot more of that stem cell efficacy. Then we got the IV Myers cocktail, all the B vitamins, magnesium, all of that, and the NMN. Both did, felt great on that day. And then I had hyperbaric every day for the protocol where you go up and down. Is it 30 minutes of breathing oxygen and then the break? And I'm not sure how that's divided, but it's like that.
It's about 80% of the time you're
Got it.
breathing pure
Yep.
oxygen. There's only about 20%
In the
that you're
middle.
not. Yeah.
Yeah, and again, I told you how much better I felt with that. And then I also had a facial with exosomes. I had IV
Yeah.
exosomes. It was just really, really well thought out because it wasn't just like you said. I think the efficacy, and especially if you're not counting cells of just the stem cells, is way, way less than when you surround it by all the things we know to nourish that transplant.
Yeah, I think that's right. If you kind of step back for a second and we just talk about the science, right? So stem cells were in your body for a specific reason, right? They have basically three properties, right? The first one is that they're incredibly anti-inflammatory in nature, right? That's why we got them all. Remember when we were kids, we'd go out on the playground and fall down and scrape our arm, and 2 days later, it's like nothing ever happened, right? There's no scar, there's no nothing. You and I go do that today, it might
Mhm.
take months for
Yeah.
it to heal. And then the second property is this regenerative property that it has, right? And so, since these cells are kind of unassigned, they are ready, willing, and able to be assigned by whatever's necessary, right? And then when you add the exosome component to it, which is exosomes are kind of vesicles, if you
Mhm.
will, and you can load them, or we load them with growth factors and all kinds of things to try to be helpful. But they're kind of the best way that I can think about exosomes are they're a sheet of music. I mean, they're a set of instructions, or like
Yeah.
a sheet of
Yeah.
music. They tell the stem cells what to do. And so when you do those and when you do them in conjunction with each other, there's a really good outcome. And then the last property that stem cells have is that they have this incredible ability to modulate your immune system. And so that's why we see so many of these cases of autoimmune. Although today autoimmune is like saying Coke or Xerox, or I mean,
Yeah.
there are so many different autoimmune diseases. You're an expert in that space. But so when 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 we inject those stem cells, the reason why we send PRP with it is for what you just articulated, is because the stem cells need a little bit of time to get to work.
Mhm.
So if we can get you just a little relief and a little lubrication up front, especially in these articular joints, right?
Yeah.
It's super helpful. And it gives the stem cells enough time to work. I would say that the stem cells, on average, by the time you get to the 6 month mark, it kind of is what it is.
Uh-huh.
Whatever relief, whatever regeneration you've gotten, whatever benefit you've gotten, that's kind of the outer marker. And so people ask me all the time, how many treatments am I going to need before I feel better? Well, of course, I can't answer that. Everybody's different. But most of the time, like I would say, and I don't, you can tell the crowd in your case, what level of improvement do you think you have today?
I'm still at
Yes.
80% and I'm expecting more because I've only been a month out. So
Yeah,
I
that's
don't think I'll
probably
need
right.
any more treatment on my shoulder.
Yeah, and that very rarely do we, but there are cases where people, say, "Hey, I only got to 60%. I want to get
Mhm.
more than that." And we're like, "Hey, yeah, absolutely. Come back. We'll work something out. We'll try to help you to make sure it's
Yeah.
affordable and that can happen." So,
Very good.
for sure.
Now, the other option that I could have done, but I chose to do the shoulder was IV. And I want to hear a little bit about, you've told me some really neat stories. So IV is going to go, and this is something too, I don't think is as easily to get in the US due to the stipulations. Sometimes there are places that do joints and they're autologous, which is from your own body. But if I'm 48, it's going to be 48-year-old stem cells, so it does
Right.
make a difference
Right.
versus the mesenchymal stem cells that you offer. But tell us a little bit about your stories or your case studies of IV stem cells and how that might differ for someone with systemic illness.
Yeah. So people ask me all the time, why is it you guys treat so many things with, kind of advanced orthobiologics and, advanced cellular therapy? And the answer is because, most of the time something is not present. And generally, what's not present is some type of a stem cell or stem cell derivative, right? I mean, take a look at Parkinson's, right? Obviously, that's a lack of dopamine cells. And those dopamine cells that go in the nigra, right, that are in that kind of right above the stem, right above the spinal column, and then the brain stem, and then there sits the nigra, right? And it's very clear and easy to see by a physician to look in the nigra and see, are those dopamine cells present or are they dying? And that's how one gets Parkinson's. And so we have a very effective treatment for Parkinson's, because in the nigra, in both sides of the nigra, what we see is that's what controls motor skills, right? So we see that kind of tremor go away, when we start to rebuild that reservoir, if you will, of those cells. So I think that's just one example of many things that we treat. And obviously, because of the anti-inflammatory nature, any inflammation related disease, well, if you don't know, 90% of the deaths worldwide last year in the world were inflammation related. Cancer's inflammation, cardiac diseases inflammation, and so there's lots of things that you can go after. And then there's this thing called anti-aging, which is, how do I live a higher quality of life? I mean, if you look at our tagline and everything that we're about, is it's trying to bring up the quality of life of the people. And so we have lots of folks that come to us that want to talk about anti-aging and how to be better. And I think David Sinclair said it best. He's written several books and is probably one of the top 3 people in the world around longevity. And he said it best when he said that all these chronic diseases are just a downright consequence of aging. And so you got to fight the source, which is, how do you help people age slower? And this may surprise some of your listeners to know, but there's a very easy way to figure that out. And I know from talking to you that you participate in that as well. It's epigenetic testing. So we do epigenetic testing to start our protocol for anti-aging, right? Where we test 850,000 sites along one's DNA strain. And we can tell how old you are. You know what your chronological age is, right? That's the number of candles on your birthday cake. Mm-hmm. But we can also tell you what your cellular age is, which is the most important thing. Yeah. Your chronological age means really nothing anymore. It's what's your cellular age. But more importantly, was it 5 years ago or 4 years ago that we're now able to tell the arc of your aging?
Yes.
And that's
the
most
trajectory, which means like how fast, it's like the rate at which you're aging, right? So am I aging 1.5 years faster than normal years, which means I'll be more likely, 60 years old in half the time, right?
Yeah, that's exactly right. And so we use that data and we do what are called Bookend epigenetic tests, because it's really important to us.
Yeah.
Evidence-based medicine
Mhm.
needs to be the rule of thumb, not just, hey, let's take a shot of this and see what happens. We need to measure these things and determine, are we winning? Are we losing? Where are we? But so that starts our protocol. And as you know, that's super easy and cool. Now we can send that test out to you. You can send it to them. They can, hit that button on the test and it draws their own blood from you. You can't feel it. It's amazing. You send it off to Kentucky near Duke, and they process that, and they get like an 8-page report and you get a 128-page report. I mean, it's amazing. But that starts the protocol. And then from there, our anti-aging protocol surrounds the idea of using high volumes of stem cells through kind of IV introduction. Mm-hmm. And that kind of starts flying around your body, and you'll start to see them attack these areas of inflammation, because we all have them, right? And so we see crazy things happen where people will say, will call us back and say, oh my gosh, I've had this arthritic, fingers in my left hand, and now I can make a fist where I couldn't make a fist again. And you start to see some really interesting things. But more importantly, you start to see better metabolic rates. You start to see improvements in their blood work. And then ultimately, when we get a year out, then we do another epigenetic bookend test and we look at, are we slowing the arc of their aging, which is the goal. Now you got to do some heavy lifting, right? Which I know you're great at helping people with that, which is, you know, make good lifestyle choices, exercise, do all the things that are important. But it is very clear. And I think if you ask David, and I've had this conversation with him, that he would tell you that he has stopped aging in rats. He would tell you that. He's told the whole world that.
Right.
Has he? I'm not sure.
Uh-huh.
Maybe, but I know this from our experience that we have slowed the arc of people's aging, which is I think is incredible.
I do
That
too.
is,
And I think this is why I'm talking to you, Steve, because number
yeah.
one, I've been looking for years to find a kind of the place that I would believe has the ethics, the integrity, the quality, like you have created at Renew. And I feel like I found it with you guys. So I'm super excited to share with the world and all of our listeners what you're doing. And also just this is the future of medicine, because just we have such an environmental toxic load, our air that we breathe, the food that we eat,
Mm,
that we need to be really thinking through. Obviously, that's important as the baseline, like you said, movement and food, but also these kinds of things are moving the needle much more quickly. And I think it's a combination. So I really, really love, and of course, for me, or maybe we talk for a moment to physicians. I have a lot of physicians who listen, because
sure.
I'm out there as a physician, and to me, a partnership with someone like you is so crucial because in my clinic, I'm, finding the environmental toxic load and helping them clean up their environment and making sure they're eating right, making sure they're getting with a strength and conditioning coach and aerobic training program and all those things, and then maybe some supplements, some basic things there. And that's great, right? That's the foundation. And I can help them when they come back from your clinic. But what I love is I can send them to you. And if you're a doc out there, it's such a great synergistic connection to send your patients to this beautiful place near Puerto Vallarta on the beach. I mean, it was so lovely. I loved my stay there. And to get the very, very best. And not only that, but as a doc, I have complete confidence in what you're doing, the integrity, the quality, the protocols, all the stuff you already shared with us. So I'm hoping to share with my colleagues as well what you're doing because I think it's really, really a great synergy for us in healing our patients.
Yeah, no, I think it's great. We have obviously lots of physicians in all different kinds of categories that we have partnerships with that send us patients. And I think what's really important for us on that standpoint is that, we have them for a week, you have to live with them for a year.
Yeah.
So it's really important that we deliver well and execute well so that when they go back to you, they've had a great experience and they feel like it was well worth their time. And, we have lots of repeat customers that come back. Most of the time, what happens is they have this kind of, they have this orthopedic issue, right? My knee, my shoulder, my hip. And they say, can you help me with that? And then, we obviously attack that and get a good outcome. And then they come back and say, okay, now I want to open the toolbox.
Yes. What
I want to
else?
talk about sexual wellness. I
Uh-huh.
want to talk about
Yeah.
performance management.
Yeah.
I want to talk about anti-aging. I want to start to really use all 17 specialties to try to optimize and get back in control of my life. And then the only thing I always want to say before I end any podcast or any interview is that to let people know that there are alternatives. You don't have to always get your hip replaced. You don't have to get your knee replaced. You don't have to get your shoulder replaced. Outside the US and Canada, there's an international protocol that's very simple. PT first, right? Physical therapy first. Can we solve your issue with physical therapy? Stem cells second. Can we fix it with stem cells? Third is what we call a manual fix, which
Mhm.
would be, surgery of some kind to do that. And the other thing that I would say to people out there is don't wait until the volume gets so loud of pain, because then you leave us very few choices, right? Except for potentially a manual fix. The reason that knee aches or that shoulder aches or whatever that issue is because that inflammation sitting in that joint and it's literally melting the joint.
Mhm.
So attack it early and often, and you'll be glad you did.
Gosh, I love that you said that because even my father recently, his hip was completely gone. He did get some stem
Yeah.
cells and it helped him buy a little time, but it was so far. He's the old farmer who doesn't complain, so he probably went for
Yeah.
20 years on a really bad hip and no one knew. And I'm like,
Yeah, for
gosh,
sure.
Dad, if had you known about this and it couldn't, the outcome is fine. But I really, really, for personal reasons, I'm so passionate about that because if we can catch people, even my shoulder was relatively minor. It did not require surgery. And here I am, probably in a few months, going to be 100% pain-free is my
Yeah,
expectation
for
with as
sure.
well as I feel now. So I love that. And I love this collaboration. And just for the practicality, if you're a physician or a patient, you guys are screening, making sure there's no cancer cells. So you have a
That's right.
exact lab protocol that say I'm your physician, your doctor could order those labs and do,
That's
say, an
right.
MRI of your shoulder before you go, make it really easy. If you're my patient, I would do that before I'd send you is make sure I have the labs. And it's so easy because we send that to you guys. Then your doctors look at that. You consult with a patient. And the other thing I love about your integrity, Steve, is your doctors will look at that data. They'll look at the shoulder, the knee, or the hip, and they're going to give a good analysis of this is something we can treat and likely we can help you. Or you know what, this is not, this may be too far gone. And I really love your integrity and also being able to tell the patients the kind of people that are best suited for stem cells, right?
Yeah, we can't help everybody.
Right.
Not everything works for everybody. It's not inexpensive. I mean, it's just not one of those things you say, oh, well, I'll give this a shot if it's not going to have any kind of potential outcome. So it's really important to us that we work in conjunction with our professionals. And I love it when people like you partner with us, that you guys handle all we got to do is the
Yeah.
heavy lifting
Your
when they
part.
get there, right? You guys get them all prepped, ready to go. But we have every kind of relationship where some people just, hey, call
You.
Sue and here's her issue and take it from there. And then we've got great partnerships with folks like you that kind of everything's prepped ahead of time, everything's ready, everything's, all the pre-screening has been done, and all we have to do is just do the work once they
Yeah,
get
and
there.
either way,
So
if you're out there listening and you're just like, I want to talk to Steve's clinic and get to know more, you can just directly contact them. You don't need a physician referral. And you guys have been so gracious to set up a landing page. We'll include this in the show notes if you're driving or whatever. You don't have to remember it, but it's a very easy. Their website is www.renue, renue.healthcare. And if you just do /Dr. Jill, there's a landing page with all the information that you can get and get connected directly to them.
yeah, that's right. That's right. Yeah, renew.healthcare. No .com necessary. Since we're a hospital, technically we can use the .healthcare extension. So absolutely, yeah, it's a great way to get in contact with us.
And just hit that /Dr. Jill and you will be. Steve, this has been so good. Like I said, just my experience down there with you, with all of your team was extraordinary. And I really, really want people to know that you have done things with the utmost integrity and thoughtfulness. And I can't wait to see how this continues to help people. And I'm so happy to be a part of the experience for me and also just the ability to get the word out for you guys and what you're doing because I really, really believe in it.
Yeah, no, I appreciate that. And it was great to have you, and I'm excited about your shoulder
Yeah.
and yeah, the continued success with that for sure.
Yeah.
Next time, anti-aging, right?
Yeah, exactly. I'll be back. So I
Yeah,
will be back.
that's right.
Oh, well, bless you for all the great work you're doing in the world, for listening to that little voice in the night to start this and to change lives already. We could talk another hour about some of
Oh,
the cases that you've seen and that. So maybe we'll have to have you back. But for now, if you guys want to know more, just go to renew.healthcare /Dr. Jill. Check it out. And Steve, thank you so much for your time today.
yeah.
Hey, everybody. Thank you so much for joining me for another episode of Resiliency Radio. I love introducing you to new, fun, exciting things. And my experience at Renue was just so profound that I wanted to be sure and have Steve on the podcast and share with you all of the amazing things that they're doing and just the high quality and caliber of staff, research, equipment. As you can tell, it's really a first class place to go if you need stem cells. If you want more information, be sure and go to renew.healthcare /Dr. Jill to get a special deal, get more information, have them contact you. Or if you're a doc and you want to know more about referring your patients, renew.healthcare /Dr. Jill. Check it out. Just super excited to be collaborating and sharing the message that there are other options out there if you have a joint issue or a bad hip or a knee. And I just encourage you to reach out again, renew.healthcare /Dr. Jill for more information. And as you know, you can find us on my website for other transcripts and recordings. We come out with a new episode every week, so stay tuned. Next week, I'll be back with another great guest and look forward to seeing you then.